A quick warning. This episode includes discussion of suicide and other important mental health topics that may be sensitive for some listeners.
Oftentimes, healthcare professionals may take on this persona. I am the one that's supposed to help everyone. And so for that reason, I can't reach out for help. Reaching out for help is okay. It's okay to not be okay.
Welcome to the Path to Owning It podcast by Provide, hosted by me, Corey Brown, a marketing leader at Provide with over a decade in the healthcare industry. If you found us, you're likely an aspiring or established healthcare practice owner looking for tools and advice to begin your journey or take your practice to new heights. And you're not alone. So to help you achieve your practice ownership dreams, twice monthly, we'll tap into our unparalleled network of industry experts who will join us on our quest to provide the answers to your most pressing questions. Like what you hear? Follow us on Apple Podcasts, Spotify, or wherever else you listen. May is Mental Health Awareness Month, and it's important to discuss this topic that unfortunately affects many healthcare providers. Today, we have the pleasure of speaking with Laura Magnuson. Laura is the VP of Clinical Engagement and a licensed associate marriage and family therapist at Talkspace. She is responsible for helping employer and payer clients realize the inherent clinical value of a comprehensive mental health system for their various populations and bringing mental well-being and treatment to life. She also provides industry thought leadership to HR professionals on creating a mentally well workplace. As a mental health first aid instructor, she is passionate about mental health education and how that translates into an effective and healthy workspace. Laura, thank you so much for joining us today.
Yeah, thanks for having me.
Of course. And I am just very pleased that we're talking about this topic that affects so many. We're going to be going inside mental health in the healthcare industry today and kind of learn how to protect it. So if you could just start, I would love for you to just tell us a little bit more about yourself and your background.
Yeah, sure. So I've been in the mental health space for about 20 years. I have a master's in marriage and family therapy as well as forensic psychology. And I've worked in a variety of different settings. So I've worked as a supervisor at a crisis line. I've worked at an inpatient psychiatric hospital. I've worked with the seriously mentally ill population. I also worked for a payer before coming to Talkspace as well. And so now my role at Talkspace that you defined very well there is really just assisting individuals with understanding our services and putting together a mental health strategy. So it's a great space to be in. And since COVID has happened, I think we're talking about mental health more. And so the clinician at heart in me is really excited that that light is being shown.
Yeah, absolutely. Can you tell us about any specific experience you may have with healthcare providers?
Sure, yeah. So I did work at an inpatient psychiatric hospital and so interacted on a regular basis with providers there, psychiatrists, social workers, nurses. And then also, not just in the clinical setting, but also in my role today, we partner directly with several healthcare agencies or entities and partner with them on different education levels. So we've actually rolled out a pretty comprehensive education program to one healthcare system that's located in Massachusetts and continue to service that population across our book of business as well.
Oh, that's great. I'd love to know, because we hear, stress is a big factor for many healthcare professionals. Can you tell us some unexpected side effects of stress that people may not recognize as symptoms of a mental health problem or crisis?
Yeah, I think that oftentimes individuals forget that stress can really show up somatically in your body. And so oftentimes that can look like a variety of different things. It can be stomach aches or headaches. It can be the inability to sleep or sleeping too much. It can also affect, your eating habits as well. So I think oftentimes we think of stress as this, we know that we're stressed out when we feel the need to get away, but we also really need to pay attention to the signs that our body is giving us as well, that stress might be present.
And because I deal with this myself quite a bit too, how do you know when stress is the root cause of maybe one of those problems you're having as opposed to something else? And doesn't not knowing just cause more stress sometimes?
Yeah, I think it's really right. You have some anxiety about how do I start to feel better, right?
Yeah.
And so I think that doing things to take care of yourself and seeing if that is helping the situation that you're in or whatever symptom you might be experiencing, I think that that's really the place that you start. But I also think, and of course, my big push with therapy, right, is exploring your stress levels and talking about how it's showing up. And of course, following up with your medical, physical health provider as well can be important too if you're seeing some of those somatic pieces to make sure that there's not other issues that are underlying.
Yeah. So when should someone reach out for help? Does that be when you recognize some of these symptoms that you've been speaking of?
Yeah. So I think you reach out for help even before you see those signs if possible. We know that preventative care is really the way that you're going to see your best recovery. And so I always try to give some physical health examples because I think that mental health oftentimes can be like this gray, ominous cloud that people don't always understand and it can be vague. And so I always give the example of if you started to have a toothache and you went and you saw the dentist and you got that taken care of with maybe a simple cavity, you're going to leave and you're going to, maybe you take some Advil later in the day, but your recovery is going to be minimal. As opposed to if you wait because maybe you're petrified of the dentist, right? And so you put it off and you put it off and you put it off. And by the time you get there, maybe your tooth is abscessed, maybe you need your tooth pulled, a root canal, a crown, right? Whatever that looks like, your recovery is going to be longer because you put off that care that was needed. And so my soapbox, if you will, is really reaching out as early as possible and developing those self-care strategies. But I think that absolutely, if you start to feel any kind of behavioral shift, or even if you see that in a colleague, that's when we want to make sure that we're having those important conversations. So if you feel like, maybe you're not showing up like you used to at work, or you're noticing that in a colleague, maybe your, again, sleeping patterns, eating patterns have changed. Your physical health doesn't feel great or the way that it used to. I think absolutely that those are signs to reach out for help.
And I'm curious, do you see a difference in the way that men, women, and our non-binary populations handle mental health?
Yeah, I think that oftentimes just looking at society and how individuals probably grew up, oftentimes I think females are more socialized to talk about their feelings than males or that non-binary population.
Yeah.
And so we think that really we see that, unfortunately, men wait until the issue is bigger and closer to a crisis before reaching out for help. And unfortunately, what we see with the statistics as well is that more males die by suicide than females do, even though more females do attempt suicide. So yeah, I think that there's a lot that's happening related to how individuals are raised and how emotions and mental health are spoken about when you're growing up.
Yeah. How do you think we can help break that cycle?
I think normalizing talking about how people are feeling. I think having it be part of the conversation, asking individuals, hey, I'm a little concerned about you because you don't seem yourself. Can you tell me what's going on? Or letting people know, hey, I'm here if you want to talk about anything. Reminding individuals about resources that might be available, right?
Yeah.
And speaking about our own stories. So maybe if there's any struggle that you've encountered personally, are you able to share it in a space so that there's a normalization that we all have different challenges that we go through, and that's okay and expected. And reaching out for help is definitely something that we know takes courage sometimes related to stigma around mental health, but that is okay and that individuals do recover.
Yeah, I think that's so important. And that's a big reason why we wanted to do this episode. So thank you again for joining us and speaking to this. Back to stress a little bit. Can you share some simple strategies for coping with a stressful job? We hear that from aspiring owners to associates and practice owners alike. So what can you share that may help them?
I think that oftentimes we wait for like the vacation, or we wait for like the day off and we think I'm going to handle my stress when I go on vacation, right? Like that's my thing. Instead of building in simple, short pieces throughout your day, every day. So things like blocking out your calendar so that maybe it's for 5 minutes in the morning, right? You're taking time for yourself and whatever that looks like. So whether it's, jotting down things that you're grateful for throughout the day, getting up and walking around the block, right? Getting some fresh air or just even stepping outside. I think trying to place those pieces, which again can be really short in duration of time, just consistently throughout your day, every day, I think can really make a difference instead of kind of holding off for this big thing, right? That we've typically thought about with self-care. It's like, I'm going to go to the beach, right? Or I'm going to a spa, or I'm, going to play a certain sporting game, right? If we can build the little things into the day, I think that can make a big difference.
Yeah. And that was my next question is how does one find time? But it sounds like we have to make time and schedule it and prioritize it, right?
Absolutely. Absolutely. Because the thing is, right, if you don't make time for wellness, then you're going to have to make time for illness. Not my quote, but I think something that's important to call out, right? That if we don't take care of ourselves now, it's going to catch up with us later.
That's a great point. I want to bring up something that we read about recently that is something kind of new that we hadn't thought about. A lot of doctors are using social media to grow their practice, but we're starting to see some cyberbullying situations, whether it be a pet owner that wasn't happy with the service or a patient who maybe thought they were diagnosed dental treatment that wasn't necessary. How does one, I guess, start to grow their practice but not let those kind of negative comments get in the way?
Unfortunately, we live in this environment where individuals are quick to go to their keyboards and be warriors behind a screen instead of having a conversation in person.
Yeah.
I'd definitely say that that's a downside of what we see. So I think that maybe initially when things started that way, it probably was really hard to take and accept. And now that we see a lot of these pieces, I know even when I read negative reviews, that oftentimes I'm like, well, the people that are going to write the reviews are generally the unhappy bunch.
Yeah.
And I think more and more we're taking it with a grain of salt. It doesn't mean as much as maybe it used to. So not to say that negative commentary is ever something you just want to brush off and ignore. You definitely need to look for some common themes. But I think generally people have an understanding that there's going to be negative reviews sometimes. And if there's a way that you're able to accept that that's just part of human nature, unfortunately, right? You can't make everybody happy. As long as you know that you're doing your best and you did what you believe is right, I think that's where you really need to live with that message and that self-talk.
Yeah, no, that's a great point and totally right. That's why I go to the 3-star reviews because I feel like that gives me the whole real picture, right? It's not
right.
Yeah. Okay. And I want to get a little more serious for a second because in my research for this episode, I discovered some fairly disturbing statistics. I want to get your thoughts. Doctors, dentists, and healthcare professionals ranked at number 11 on the Center for Disease Control's list of the top 30 occupations likely to die by suicide. Another 2019 CDC study showed that veterinarians specifically are between 2 to 4 more times likely to die by suicide than the general population. A myriad of proposed causes fueling these numbers range from things like financial stress, long working hours. In veterinarians' case, the exposure to trauma and euthanasia was proposed to play a big part. So just curious what your thoughts are as to why the healthcare profession seems to have a higher number of deaths by suicide than others.
Yeah, I think that oftentimes healthcare professionals may take on this persona that I am the one that is here to help others. I am here to, whether it's a human or a pet, right?
Yeah.
I am the one that's supposed to help everyone. And so for that reason, and we see it along the same lines with first responders as well, I can't reach out for help. I'm the person that needs to fix this issue. And absolutely, COVID has exacerbated, I think, probably what that veterinarian population has seen.
Absolutely.
As far as, unfortunately, pet owners and what happened with everybody, right, running out and getting a pet during that time that maybe shouldn't have. And so I think that there's really this persona that oftentimes our medical professionals take on that I should be able to handle this because I can handle all of the other components. That stigma that's attached to reaching out and asking for help.
Yeah.
I would say the positive piece is that I know dentists, for example, used to be much higher on that list.
Yes.
Yeah. So now we're seeing construction, we're seeing mining industry.
Farmers, I've read.
Yes.
Yeah.
At least this population is also trending in the right direction. But I think that it's the stigma that is still attached and the pieces of being afraid to reach out for help.
What can we do to help healthcare providers with that thought of, I'm the one that's supposed to help, I've got to fix this myself? What can we do to kind of curb that thought? And on the other hand, if yourself or someone is considering suicide, what steps can we take to prevent that?
I think it's continuing the conversation and normalizing that so many individuals experience thoughts of suicide, having an understanding that oftentimes those thoughts are temporary. And so getting that added support is really going to be beneficial. And that if we are able to really look to others around us, right, and educate them about mental health, that's only going to empower everyone as a group, which I know is why you're even having this conversation, right? Empowering the group that reaching out for help is okay. It's okay to not be okay. I think that oftentimes there is, again, kind of that facade that individuals feel like they need to keep up. I think we're slowly chipping away at the stigma with what we've seen with COVID, right? We're talking about mental health more than we ever did before, but there's definitely still some room there.
Yeah.
So being able to share your experiences can be really powerful. If you are having thoughts of suicide, there's a variety of different resources available. I will call out 988 is a national suicide prevention hotline that is available across the United States, available in Spanish as well. And you are able to call that number at any time and speak with an individual who's able to assist with whatever you might be going through. Also want to call out, you can call that number when you're not in a crisis. So if you're looking for additional resources, if maybe you're concerned about a colleague and you don't even know how to start a conversation, they can be there for that as well. So I know oftentimes we think about crisis and that number is associated with crisis, but you can call before things get to a crisis as well. And I always encourage folks to call that number before they need it, just to see what it's about. So they know that if they encounter something in the future, they know what to expect.
Yeah. Thank you for sharing that. And that's just 988, correct? Like 911, 988?
Correct.
Okay.
Correct. And they put that number together for that very reason, that individuals could remember 911. And so oftentimes individuals were calling 911 and receiving a law enforcement response. And so it was recognized that individuals didn't have this universal number for some kind of mental health challenge. So that's why that number was created.
Gotcha. Laura, we've talked about how to recognize the state of your own mental health. And when we come back, I'd like to get your take on how to be an empathetic leader of your practice and make sure your employees are staying healthy too. More with Laura Magnuson right after this. Ready to take your practice to the next level? Meet the Provide Card, the credit card built specifically for healthcare practice owners. Available in addition to your Provide practice loan, with the Provide Card, you'll be transported to a world of new opportunities for your practice, where you can access the spending power you need to build your legacy. You can earn rewards on all purchases, all the time, with no rotating categories and no point expiration. At Provide, we're creating the future of personalized banking for healthcare practice owners. To learn how to apply for the card that makes your purchases go the extra mile, contact your Provide representative or visit getprovide.com/providecard for more information, including rewards terms and conditions. I'm Corey Brown, and this is Provide's The Path to Owning It podcast. We're back with Laura Magnuson, VP of Clinical Engagement and a licensed associate marriage and family therapist at Talkspace, to talk more about improving one's mental health, as well as the health of their staff. Okay, Laura, so we've talked about personal mental health. Let's talk a little bit about leadership and how a healthcare practice owner can ensure that his or her team stays healthy too. Any recommendations for ensuring one's staff is staying mentally healthy?
Yeah. I spoke about it just a little bit, but I think being able to take that leadership role where speaking about mental health is normalized and accepted. And if you have a story to share that with your staff and what worked for you. I also think that any way that you're able to open up those conversations. So if you have regular one-on-one check-ins, making it a part of the conversation of, hey, how are you doing? Or if there's an especially stressful experience that maybe individuals went through, saying, hey, that was really tough. I just want to check in and see how you're doing, right?
Yeah.
So normalizing those check-ins, I think there are also things that can happen in the workplace if you're looking at different benefits as well. So things like mental health days, are those built into your days off, like PTO as well as sick time? That sends a message that it's okay to take a mental health day now and again. Also making sure that your employees are familiar with your benefits, whatever they look like, and saying, hey, just as a reminder, we have this benefit available through EAP or Talkspace or whatever that benefit is, and sharing how to access that on a regular basis. I know that there are certain populations that add in that line, even in the signature of their email address, because oftentimes we don't remember what's available until we need it. And so making those resources easily accessible, whether it's a website or a signatured tagline, whatever that looks like for your population, I think posting by a time clock, right? And speaking about it frequently can be beneficial.
Yeah. Besides PTO days and, health insurance that may cover things like therapy, are there any creative things you've seen employers do? I'm just curious that allows them to, still have a firm, high quality expectations for their staff, but also allows them to lead with empathy.
Some creative things that I have seen, and I don't know how it might apply to this particular population,
Sure.
But things like no meeting Fridays or having some kind of expectation for downtime. So maybe it's not no meeting Fridays, maybe it's nothing after a certain time frame. I also saw just recently, and I loved it, someone had sent an email and it was past business hours. And at the bottom of the email, it said, I am sending this email when it's convenient for me, and I don't expect you to respond until your working hours. So please don't take this as an expectation for response, which I loved because oftentimes, if you get an email after hours, you're like, oh, I feel this obligation that I have to respond, especially if it's from someone that maybe is at a higher level than yourself. And so if you're able to even add in little pieces like that and ask people, hey, what are you doing this weekend to take care of your mental health, right?
Yeah.
So little things I think that can go a long way.
Yeah, I love all of those things. I think this could absolutely apply to our audience in different ways. So thank you for sharing that. You mentioned a few of these already, but again, just curious, other recommendations to maintain good mental health. We've talked a little bit about your sleep habits, doing things outside like yoga or running, food choices. How much do these things actually help?
I think it's going to depend on the individual, right? So if you enjoy running, if you enjoy yoga, that is definitely going to be beneficial. We know that there is a mind-body connection. And we even see that if we were to be looking at medical claims, we know that when individuals take care of their mental health, that their physical health improves as well. And so I would say if you enjoy that activity, then that's wonderful. I know yoga stresses me out. So that is not an activity that I am going to engage in if I'm looking to reduce my stress, right?
Yeah.
So
right.
I think it's really figuring out what works for you. But absolutely, that exercise component can really be beneficial. Time alone, volunteering, so many different components can really go into assisting mental health and figuring out, again, what makes the most sense.
Absolutely. We've talked a little bit about this before, but I think it's super important. So I want to reiterate, what can a healthcare provider do if they recognize themselves or a staff member demonstrating signs of poor mental health?
Being able to have a conversation about it. So first, I'm going to talk about if you notice that someone else might be having a struggle.
Yeah.
I think approaching someone with empathy and saying, hey, this is what I'm noticing. I care about you and I'm concerned. Can you share what's going on with you right now? And maybe that individual will open up. Maybe they won't. But I think even if they don't, saying, hey, I'm here if you ever want to talk, the door is always open. And just as a reminder, these are the resources that we have available, right? Because maybe it's going to take it some time to digest that it's okay to have this conversation, and then they will come back maybe in the future. If they're open to talking at that moment, then absolutely continue that conversation. If someone sounds like they're really struggling and they're starting to open up and you don't know what that means, there's also importance on asking someone directly, are you thinking about killing yourself or are you thinking about suicide? Because oftentimes if an individual is having that thought and you ask the question, it's going to be such a relief. It's like someone just gave me permission to speak about what I'm really feeling. And then, right, getting that individual connected to the right resources. And maybe it's calling 988 if you don't know any other resource, right? That's a great place to start as well.
Sure.
But asking that question directly, I think oftentimes we get really nervous about saying the right thing and responding in the right way. And so sometimes we wait for someone to bring that piece of information up. Being able to ask directly is really important. I think that if you start to recognize that maybe you're not doing so well, again, just reaching out for assistance and understanding what resources are available, whether that's going through your EAP, whether that is understanding what benefits there are. Again, if you don't have any idea, 988 is a great place to start as well. They'll get you connected. If you feel like you can't keep yourself safe, if you feel like you are really in this crisis moment, you can always take yourself to an emergency room. That is an option as well. So, but if you do call 988, there are many communities that can also send a mobile team directly to you. So whether it's you or someone else that might be struggling, and really stand next to you and support you and get you to that level of care that you need.
Yeah, those are all great points. Thank you. I'm curious if you do recognize this in someone else and you approach them like you had mentioned and they don't open up right away, right? Do you follow back up with that person in a similar way, within a week or 2 weeks or something? Or what's the best, follow up to ensure that that person is doing okay?
Yeah, it's going to depend on what's happening with that individual, right?
Sure.
But I think absolutely saying if you've had this conversation and you give it a couple days or a week and circle back and say, hey, I just wanted to remind you that I'm here for you and I continue to be concerned. And you can ask them directly, do you have somebody that you're talking to? Or do you have anybody that even maybe I could call and we could start the conversation, recognizing that maybe you're not the person that they want to open up to.
Yeah,
right? And that's okay. Just knowing that they have someone to talk to, I think also can be beneficial as well.
Yeah, that's great. Laura, can you speak a little bit about Talkspace and your strategy when it comes to those who seek mental health assistance?
Yeah, absolutely. So Talkspace is a completely virtual provider. And so we offer services on a continuum, meaning we start with self-guided pieces. So we have something that you could look at every day without really necessarily interacting with someone. So if there's a particular topic that you're interested in, you can read about it. We also have live group sessions where everyone shows up as anonymous. They're led by a licensed therapist, and you can ask questions and engage with that therapist in an anonymous manner. And then those are all recorded and kept in our library, so you could go back and view them on demand, as well as some daily journaling prompts as well. And then we also offer therapy. And this is probably what you might think of when you think of Talkspace, if you've heard Michael Phelps doing our advertising. But we offer therapy in a variety of ways. So video sessions, which are pretty common, and everybody understands what that means.
Sure.
But we also offer messaging therapy. And that's a little bit different, where you can send a message and it can be written out almost like a text message would be. It could be a recorded audio clip or it could be a recorded video clip. And so you can communicate back and forth with your therapist that way in an asynchronous manner. And that's been really beneficial as we see individuals that maybe, they have different shifts and they're getting off work at 2 a.m. and they really want to be able to get something off their chest or share with someone what's happened. They don't have to wait a week to share that with their therapist. Now, the therapist might not respond at 2 a.m, but they are going to respond as soon as they're next available. And then the last component that we have through Talkspace is psychiatry services. So individuals that maybe want to have an assessment for their medications, see if they should be on medications to start with, And then also that ongoing medication management, and that's done via video sessions.
I think that's great. It seems like, if somebody's nervous to reach out, there's ways for them to ease into that, which I think is fantastic. Can you talk a little bit about your therapists? And I believe they all have master's levels of education, if I'm not mistaken.
Correct. Yes. All of our therapists are master's level and licensed by whatever state that they are providing those services in. Our therapists have, on average, 8 years of experience. We also offer a great support network for our therapists. So we offer ongoing education and an ability to continue to grow your skills or learn about areas that maybe you weren't proficient in before. So that is a great benefit and really why we're the provider of choice for our therapists. And so I think, there's so many different ways to access therapy now. And what we have seen at Talkspace is that 50% of our population are engaging with therapy for the first time. So like you mentioned, it's an easy entry point, right? Maybe you're concerned or you're scared because you've never engaged before. And so sending a message and not having to be on video is great. And you can do it at your desk while you're working or on a break, I should say.
There you go.
I don't want to get anybody in trouble. So lots of different ways to engage in services.
That's fantastic. And if somebody's ready to engage, what's the best way for them to contact you after hearing this episode?
So they can go to Talkspace.com, and we partner in a variety of ways. So you'll be asked different questions to figure out what the best way to connect is as far as payment goes. So you might be covered under your insurance. You might have a direct relationship with your employer. We also take out-of-pocket consumer plans as well. So just going to Talkspace.com is going to get you to the right place.
Awesome. Well, Laura, thank you so much for joining us and having a really open conversation about mental health awareness. If what you shared today can help just one listener improve their mental well-being, I'd really consider that a success. So thank you.
Absolutely. Thank you.
And it's worth restating, if you or someone you know is in a mental health crisis, you can call 988, the Suicide and Crisis Lifeline. Just those 3 numbers, 988. Thank you for joining us. As always, we appreciate any feedback about the show. Feel free to leave us a review on Apple Podcasts or Spotify. Have a topic you'd like discussed in a future episode? Drop us a line in the comments section or send us a message on social media. If you're ready to take your practice ownership dreams into your own hands, be sure to visit getprovide.com to pre-qualify and browse our practice marketplace, or check out our news page for more helpful resources. The Path to Owning It is brought to you by the team at Provide, and it's produced by PodCamp Media, branded podcast production for businesses. PodCampMedia.com. Producer Dusty Weiss, editor Emily Kasinger. For Provide, I'm Corey Brown. Thanks for being on the journey with us.
Provide is a division of Fifth Third Bank, National Association. All opinions expressed by the participants are solely their current opinions and do not reflect the opinions of Provide, its affiliates, or Fifth Third Bank. The participants' opinions are based on information they consider reliable, but neither Provide, its affiliates, nor Fifth Third Bank warrant its completeness or accuracy and should not be relied upon as such. This content is for informational purposes and does not constitute the rendering of legal, accounting, tax, or investment advice or other professional services by Provide or any of its affiliates. Please consult with appropriate professionals related to your individual circumstances. All lending is subject to review and approval.